In Tamale, a traditional bone setter carefully treats a fractured arm. His patient, Barkisu Yahya, was injured in a road accident. Instead of going to the hospital, she sought treatment from a bone setter, a choice many Ghanaians say is driven by cost, waiting times, and accessibility.
It's costly and it will even delay. Not even the cost, right? It will delay us.
Yahya's decision reflects a broader pattern. For some patients, even those who turn to the formal health system, recovery is long and uncertain. Teresa Adams underwent 2 surgeries after an accident, but says months later, she is still struggling.
I've gone there. I'm not healed. When I get up, then I'll know, yes, what they've done. They've done a perfect job on me.
Disillusionment with hospital care continues to fuel demand for traditional bone setting. At his compound in Yilonayile, near Tamale, Mahama Abdullahi treats more than 15 patients a day. Injuries range from fractures to severe trauma, with patients arriving from nearby communities in search of relief. But outcomes are not always positive. Salifu Inusa has lived with deformed hand for 12 years after being knocked down by a vehicle. He says months of treatment by traditional bone setters brought no improvement.
Ka tene X-ray, ka woman in Boankabe, ka Zanchan Nanton. Nanton ma, Kabalule can till betim, Benantimano. Da come, Dabata come that chen me Kabalar Canada. La Chira Yob, Minyaka Tawakana, and Kanda Tasha Polo, the Galaran Kunya Halna Zone, the Denman Shambala.
Doctors say such cases often end up in hospitals, sometimes too late to reverse the damage. Ghana has fewer than 80 trauma and orthopedic specialists for a population of more than 30 million, far below global benchmarks. Health professionals say the gap continues to push patients toward informal care.
They choose them because, one, financial constraint. They don't have money to go to the hospital because they think when they go to the hospital, it's very expensive and they can't afford. Two, belief, because they think that having an injury, it doesn't come like that. Somebody is always behind.
Despite the risks, many patients say traditional bone setters remain faster, cheaper, and closer than hospitals.
I had an accident and I was sent to the hospital. So we couldn't see any changes there. And my family had to bring me here. But for now, I can see lots of improvements.
With access to specialist care still limited and trust in the formal health system fragile, traditional bone setters, long embedded in Ghana's healthcare system, are likely to remain a first stop for many patients.